Numbers compiled by our state government show that 2/3 of Oklahomans are overweight or obese. In fact, it ranks Oklahoma as the 6th worst in the nation for adult obesity. It's an alarming figure because of the huge costs associated with obesity-related health issues. Many Oklahomans are now turning to weight loss surgery, and even the state is investigating whether its public employees should have that option in their insurance coverage. Lisa Olinger of Sand Springs has been a hairstylist for 30 years. It's a job she loves, but 3.5 years ago, getting through a day was crippling. That's because she was carrying around an extra 100 pounds. Her top weight hovered at 250. And on November 16, 2010, she had weight loss surgery at the Center for Bariatrics at the Bailey Medical Center in Owasso.
I feel so much better. I can work all day and my feet don't hurt, my back doesn't hurt. The things you can do, just simple things like getting down on the floor and putting together a puzzle or doing a board game with your grandkids.
Lisa can also exercise, go hiking and camping with her husband, all kinds of activities she hasn't done in years. Lisa struggled with her weight all her adult life, as did Angie Bowman.
I've been on every weight loss you could imagine. I'd go up 90 pounds, down 75, up 100. I've lost as much as 100 pounds on Slim Fast, Jenny Craig, you name it, but I always gained it back.
Angie used to weigh 280 pounds. The weight took its toll on her body. Angie had 4 knee surgeries and a hip surgery before undergoing gastric bypass surgery. And as the pounds started to drop off, a sense of well-being returned.
I woke up one morning, I was like, oh, my knees don't hurt. That's the first time I was just in constant pain all the time. You just learn to live with it. And I remember thinking, wow, hey, my knees don't hurt today.
Angie had her surgery 4 years ago and says she has never felt better.
And I have to say, the gastric bypass really does kind of reset your body. And of course, they can't figure out why or how. And my ex-husband had it at the same time I did, about a week earlier, and he had severe diabetes. He could never get it under control. Went in that morning with sugars of 300 and something, and that night they were 171 or 71, and never had to take another pill again.
Dr. Joe Bob Kirk has heard those kind of success stories time and again. He vividly remembers the before and after of one patient in particular.
His numbers are easy for me to remember. He took 3 high blood pressure meds a day. He took 5 oral medications for his diabetes, and a number that's easy to remember. He took 365 units of insulin a day. Bariatric surgery. This many years later, he still takes no medication for any of the above.
Dr. Kirk is the medical director at the Bailey Bariatric Center. He consults with every patient who is seeking weight loss surgery. Patients also must have a number of physical and psychological evaluations before they're qualified, and all must meet this criteria.
Typically, if you have a body mass index of 40 or greater, that is considered clinically severe morbid obesity. If you have a body mass index of 35 or greater and associated with certain comorbid illnesses, diabetes, high blood pressure, sleep apnea, degenerative joint disease, they'll name off particulars, then that's considered clinically severe.
At Bailey, patients begin the process by attending an informational seminar.
I went to the seminar and I told them, I said, I don't think my insurance is going to cover it. And Tracy said, don't worry about it, bring your insurance, we'll take care of it, we'll do all the information, we'll just find out. And so I went, I filled out the paperwork, and 2 weeks later, she called me back and said they're going to cover it.
Tracy Foster is the program director.
I would say the majority of our patients are insurance eligible. Some people are cash pay, but most insurances, most patients do come through their insurance. Not all insurances pay for it, so a lot of patients, if they can't afford to pay for it, otherwise they don't have the surgery done.
The cost ranges from $12,000 to $20,000, and while Medicare and many large companies' insurance plans do cover the cost, Oklahoma's largest employer, the state of Oklahoma, does not provide insurance for bariatric surgery. But a pilot program has been launched by the state to study the outcomes of bariatric surgery offered to 100 state employees who qualify.
We're going to submit data to them between us and the other facility of, what happened prior to surgery and then what the outcomes after surgery, and then they're going to gather that data and make the decisions on what they're going to do going forward.
Once patients are qualified for surgery, they meet with registered licensed dietitian Suzanne Galden, who explains how relationships with food will change after the surgery. For one thing, different kinds of solid food will be reintroduced over a period of several months.
And then at 4 months, our patients get really excited because then salads, fresh fruits and vegetables, so it just kind of gets a little bit more. And then last is when we say the pork and meat.
Galden explains that an average stomach is about the size of a football. After the surgery, it's between an eighth and a fourth of a cup. With just eating the food in this eighth of a cup, you would think you'd be awfully hungry.
Right. It's amazing. I think it's hard for any of us to comprehend that we could be as full on 2 bites of food as we would, a 6-ounce steak dinner. But our patients, it's truly amazing that they are truly full.
Protein drinks and multivitamins are added to the diet to make sure patients are getting proper nutrition.
I think the biggest thing is you can't eat and drink at the same time. Your stomach is so small that there's not enough room for food and liquid, and I've learned that if I can drink before and then it goes on through and then I eat my meal and then I have to wait a while before I can drink.
Lisa had what is called the sleeve gastrectomy. Unlike gastric bypass, a large part of the stomach is completely removed instead of bypassed. 60% of patients at Bailey now opt for the sleeve. The rest mostly have bypass. Another procedure is commonly referred to as lap band. A removable gastro band is tightened around the upper portion of the stomach to make it smaller. Dr. Kirk says not many patients want it or qualify for it.
I think if you've had diabetes for more than 3 years, the research has shown that it's not effective in the treatment of diabetes. So it has a high maintenance factor to it in that you have to come in and have it adjusted.
The American Medical Society says morbid obesity is a disease process, and Dr. Kirk believes it cannot be reversed by diet and exercise alone.
I have patients who eat far less than I do on a daily basis, exercise far more than I do on a daily basis, and are morbidly obese.
How do you explain that?
It is a disease. The machine is broken.
And for patients like Lisa Olinger, the surgery allowed her to give something back. A year after her weight loss surgery, her son-in-law was diagnosed with kidney disease and needed a transplant. She was a perfect match.
When you have health problems, you're not able to do the things that you want to do. And for me, a big part of this is to pay it forward. And I'm just so grateful for everything that Bailey Medical did for me and this surgery did for me. It gave me a second chance at life. And I was able to pay it forward and give my grandbaby's daddy a second chance.